And today we're going to talk about kind of a touchy little subject here, prostates, enlarged prostates. And that is, I'm telling you, I looked at some of the statistics. This is Brian Evans, and I'm telling you, the statistics are crazy. 50% of people at 60, 60% of people at 70, 70%. Everybody's headed for problems with their prostate. Men are, right?
Yeah, anybody that has a prostate is definitely going to be looking at that thing getting bigger over time, unfortunately. And there are definitely multiple options in treating this BPH.
But there's not really much you can do to prevent it. It's just part of aging.
You're going to lose your hair at some point, and your prostate's going to just get bigger.
Now, as you said, you know, this can be a problem with your prostate, can be a problem for your wife.
Oh, exactly. It's just, so if you're getting up 6, 7 or more times a night, the person sleeping next to you is also going to be getting up 6, 7 or more times a night.
So they're just excited about any kind of a treatment.
They want something to be done.
Yeah, okay. Now, you have kind of an interventional way of taking care of prostates now,
That's
right?
correct. My specialty is interventional radiology, and we call it embolization of different organs throughout the body for years and years. And now we're focusing on embolizing the blood flow to the prostate. And when we do that to each artery going to the prostate gland, it reduces the blood flow to it and the oxygen. So we're essentially put that prostate gland on a diet to get it to shrink down.
And it's not really, is it surgery? It's not surgery.
It's minimally invasive.
Okay.
So the patient, it's a same day procedure. They come in an hour before the procedure. We give some sedation through an IV, get a teeny little nick in the skin at the top of the thigh, do the procedure, the embolization, and then the patient go home about an hour afterwards.
How successful is it?
The men that we're seeing are doing fantastic. What we do is, on our initial consultation, we score men on the International Prostate Symptom Score. So anything over 20 is severe. So these men have the embolization performed. Usually a 1 month follow-up, they're down into single digits. So they've gone from 20 to 30 down to their symptoms are almost completely gone.
Oh, that's a miracle almost, I would imagine. So what if it's a minimally invasive procedure? There's not a lot to the recovery. Is recovery okay?
Recovery is great. We prepare the men for some abdominal or pelvic discomfort afterwards, but most men actually don't have any issues with it. They're just back to normal daily activities within 24 or 48 hours, and all they get is a little Band-Aid at the top of the thigh.
Most men are probably reluctant to come in the first place, right? I mean, you're gonna have to be having a problem before you're gonna go in and admit it, I guess.
Indeed, you do have to have that problem, but men have postponed other procedures because they just don't like those options. So once they find about this, they are all over it and want to have this performed.
Did anybody have any questions about prostates?
So Dr. Evans, is a healthy body beneficial to a healthy prostate?
A healthy body, healthy mind can definitely lead to healthy organs, including your prostate gland.
Okay, well, thank you very, very much. Great question, great answers. Thank you very, very much, Dr. Brian Evans with Comprehensive Integrated Care. Thank you.